This is a UC San Diego Blinkcast.
Good afternoon, this is Barry Nyman. I'm the Director of Accommodation Counseling and Consulting Services, and we provide job accommodation services to staff and faculty at the university. This is part of the Health and Wellness series, and it's my pleasure today to introduce Vicki Newman, who is a registered dietitian, has a Master's of Science from San Diego State University, and has been involved in nutritional research for the past 30 years. Please welcome Vicki.
Thank you. Thank you all for being here. This is actually, I was really interested to sort of research and put this talk together. There's a lot of information, it turns out, on the web and lots of popular books written about this topic of acid-base balance in health. And there's also a smaller amount of research literature in this area, but I'm going to try to sort of meld all those together, and we'll go through this. You have most of the slides that have information, so you don't need to take notes. And if I use some terms that seem confusing, raise your hands and let me know, and I'll try to make sure we understand. Okay, and my voice gets kind of low, so Barry was going to let me know. How am I doing in the back? Can you hear me okay? All right, and if I start to drop off, because I do that, you know, let me know, and I will, okay. All right. Before we get going with the lecture, there's a few things that I just wanted to share with you. We at the Cancer Prevention and Control Unit have developed a really wonderful practical book focused on fruits, vegetables, whole grains, and beans, which, because I'm a dietitian, you know I'm going to be talking about those things. I'm going to pass this around so you can take a look and you might consider purchasing one. The proceeds from the sale of this book go to support our Healing Foods kitchen and the cooking classes that we give for free to our patients and their families and the UCSD community. So it's a good cause. We sell it for $20 and checks are made out to the regions, the UC regions. So I'm just going to pass that around. I hope I'm not stuck to anything. And we also are having a fundraiser called the Mad Hatter's Tea Party next month. It's going to be it's actually going to be out on the Remac field, and we're going to be playing croquet as in Alice in Wonderland, and people are to dress up in whimsical attire. We decorate paper mache hats and have a little fashion show with those, and we have healthy high tea foods that we make available. So I'm going to pass that around too. If anybody's interested in coming, we would love to have you. And they'll just end up in the back. Whatever you didn't take, just leave on the back table. And then we also have a study. We do intervention studies looking at the effect of diet on disease. And we have a study just starting now that we're recruiting participants for called Help for Weight Loss. So if anybody's interested or knows somebody that's interested, this is geared toward changing lifestyle to reduce the risk of breast cancer. So I'm going to pass that around also. Where shall I start that one? Maybe with Ronnie. This is my brother-in-law. Okay, so I think the bottom line of this talk is to sort of ground us in what is going on with our environment and how the clash between this, what we call our ancient genome, okay, which developed all those years ago in a completely different environment, is sort of dealing with the changes in the food supply and other things in the environment, and the intersect between those, or the disconnect, is responsible for some of the diseases that seem prevalent in our world today. So the basic changes are ones that we've talked about in other lectures and you've heard about. Glycemic load has increased. That means there's more simple sugars and simple starches that raise blood sugar levels quickly and keep them up. Fatty acid composition has changed. Last month I was talking more about omega-6, or the pro-inflammatory fats, and how the ratio between the anti-inflammatory fats, the omega-3s, has shifted over time. Macronutrient composition would mean protein, fat, and carbohydrate composition of the diet. Micronutrient would be the vitamins and minerals. What we're going to focus on today is acid-base balance and how we think that's impacting our health. Sodium-potassium ratio, can think processed foods are high in sodium, fruits and vegetables are high in potassium, and we've had this real shift over time. More processed foods high in sodium, less fruits and vegetables high in potassium. And then fiber content has also gone down. So we aren't really going to think about all of those. We're going to concentrate on acid-base balance, but acid-base balance kind of intersects also with some of those other changes that have happened in our diet. So you all have probably read about this, but just in general, the diet that was more the normal fare way back, you know, you could say hunter-gatherer societies, was far more alkaline. And that meant that it was more plant-based, didn't have certainly processed foods, but also didn't have as much protein as we have available today. The literature in this area is basically, this was actually a quote that came out of a research paper from the American Journal of Clinical Nutrition that basically underscores the truth that the average person eating sort of the typical American diet is in kind of a chronic low-level state of acid, the balance being tipped toward acidity, and the body having to do a lot of extra work to try to balance that out or get us back to what you might call a neutral state that the body operates best in. This tendency toward acidity seems to get more pronounced as we age, and that has something to do with kidney functioning, where we're unable to keep the balance as effectively. And the net result is some of these common chronic diseases, including osteoporosis, the muscle wasting that comes with age, kidney stones, especially the calcium oxalate type stones, high blood pressure, exercise-induced or asthma brought on by exercise, and chronic renal or kidney disease. In other words, kidneys that don't work as well as we get older. So I'm going to explain how those things are related to this acid-base balance as we move along. I do want to address the whole issue of cancer, and what you see out in the web and in the popular press is this real concern that this chronic low-level acidity causes or makes us prone to cancer. And there's really not evidence supporting that, but it is true to say that tumors do create a kind of acid environment in their immediate vicinity. So you could say that that causes a stress on the body to try to neutralize that. But to say that this chronic low-level acidity causes cancer is really not scientifically supported, okay? The diet, though, that I'm going to be talking about that helps to normalize acid-base balance in our body to maximize our health is a diet that is protective or tends to reduce the risk of cancer, okay? It's a plant-based diet is higher in protective nutrients and the phytochemicals that help to increase the activity of detoxification systems in our body that help to keep us free of diseases like cancer. So again, there's this real intersect between a lot of these diseases that are common today, heart disease and cancer and high blood pressure, and these dietary changes. So the shift toward acidity, the major contributing factor has been the displacement of plant foods, which tend to be rich in alkaline minerals. When we say alkaline minerals, what comes to mind? Okay. Yeah, calcium is an alkaline mineral. Calcium, magnesium, potassium. So those, we'll talk about the foods that are richest in those and how maybe we're not getting enough of those to be in optimum shape. So one thing is this reduction in plant foods, but then the increase in animal foods, which tend to be net acid producing, okay? And grains also sort of came along, you know, not too long ago when you think of the ancient genome. And grains are slightly acid producing. They're not as acid producing as animal foods, but think about how we eat. I mean, think about what we're famous for, you know, like big burgers, okay? Humongous pieces of meat with bread. You know, where is the vegetable in that meal? So when you think about the way we eat, it's this tipping toward more acidity that's not such a good thing for our health. And the other thing that's going on is this increase in more processed foods that actually don't have some of the protective elements that help to neutralize acidity. I think the other thing to keep in mind in general is that acids are produced, and this is just a normal part of digestion, but when you think about a protein food, it's made of amino acids. You think of fats that we eat a lot of. What are fats made out of? Fatty acids. So when you eat a lot of fatty food, you're going to get a lot of acids produced, and the body's going to need to neutralize those. And you know, the body does a great job in doing this all the time. What we don't want to do is like push it over the edge, okay? So our high fat, high meat, high refined diet is kind of overburdening our body in terms of trying to keep us in balance for maximum health. So you've heard of pH meters, which measure acid base, and you know that 7 is more or less what we call the neutral area. And it turns out that the blood stays in that neutral area, okay? But it has to use alkaline minerals, for example, to keep it there. Muscle is a little bit acidic. The large intestine actually is a little bit alkaline. And one of the things that I always remember in studying nutrition way back, many years ago, was realizing that enzymes that help to digest our food they work in specific acid-base environments. In other words, I always thought of saliva as being slightly alkaline. It can get more acidic, okay? Then you end up sort of, some things work really well in saliva pH. You start chewing your food and breaking it down. Then you take it down into the stomach. The stomach is highly acid and needs to be highly acid for enzymes that digest food to work properly. Now, we are doing some kind of weird things there where we're trying to suppress acid production, you know, with antacids all the time. And the net effect of doing that in the stomach can be that we affect our absorption of certain nutrients. It could be iron, B12, even calcium. So even though I'm kind of encouraging us all to think about balance, and when we think of pH, balance is sort of at that 7 place, I want you also to realize that the body in different parts of it has different pH balance, and it needs to be different for the enzymes that are supposed to work in that area to work properly. So mouth is a little bit more, it could be alkaline, a little bit, very acid in the stomach, small intestine more alkaline, okay? Or the small intestine, stomach and small intestine are more acidic, and then the large intestine is more alkaline. So things change over time. We'll get back to some of these other beverages, but I think it's good right now to think about what might, sitting in a glass, be acid like lemon juice. If you put some, you know, litmus paper in it, you ingest it, and it can actually have an alkaline effect on the body, okay? So things change as they go through the system. So just, you know, what's sitting there in the glass may not be what's happening when it comes out through the urine, okay? So just so we're not too confused about that. So the acids from food fall into two categories, what we call strong acids. And when we say not volatile, it would mean that they're not, you know, I guess you could say gaseous. Okay, the volatile acids we tend to excrete by breathing some of them out. Okay, we also lose them from sweat. But the strong acids, which tend to come mostly from animal sources, are excreted via the liver and the kidneys and through perspiration or sweat. The weak acids that come more from plant foods, you know, think about, you know, citrus fruit. That is what we call a weak acid, okay? That would be more expired by breathing more, or we could sweat it out. One of the things I want you to sort of notice as we go along through this is some of what we call healthy lifestyle, which includes getting moderate exercise every day, kind of speaks to this whole issue of acid base, because when we exercise, we're breathing more and hopefully we're sweating more. And if you're trying to keep your acids in balance, that's one of the ways the body helps to get rid of extra acid. So kind of tuck that in and keep that in mind. So an alkaline diet is one that tends to emphasize plant foods. So we mean fruits, vegetables, roots and tubers. And you know what I mean by a tuber? I mean, like ginger is a tuber, and sweet potatoes are a tuber. Okay, roots are things like beets and carrots and potatoes, that sort of thing, and even radishes. Okay, nuts, and then beans and legumes. So I don't mean to say that we all have to subsist only on plant foods, but we need to have probably more plant foods than the average American is currently eating to be truly healthy. There's many ways of measuring the acid-producing quality of dietary factors. And I didn't even include this in your handout, but I just want to tell you that you can jot some of these down and look them up on the web if you're interested. There's something called net acid excretion, net endogenous acid production, which would mean acid produced endogenously or by the body. Sometimes they look at plant to animal ratios in typical diets to determine what's going on with the balance. And then there's another way of looking at it called PRAL, or P-R-A-L, which takes into account the protein in a food or a diet, the amount of phosphorus that's there, both of which, protein and phosphorus, tend to increase acidity. Potassium, magnesium, and calcium tend to decrease it. So they're always looking kind of for the balance of these things when they're trying to determine the amount or the effect of a food on an organism. So on the web and in the popular press, you will see many, many, many lists of foods that exhaustively will tell you the effect that those have, you know, on acid production in the body. And fish meet very high in their acid producing potential. That's why we need those foods, but we probably don't want to have great pieces of them, okay? Poultry, eggs, shellfish are a little bit lower in acid producing capacity. And then you get down to the milk products, and they are still considered acid producing, but they're much less acid producing. And cereal grains are quite weak in terms of acid producing, but we eat a lot of them. So, you know, it's always the intersect between the potential to create acid and kind of the portion of these that we have in the diet that's an issue. So the bigger the number, the more acid producing capacity that food has. Then you go to base or alkaline producing foods, and the minus, the higher the minus number, the more alkaline it is and the better it balances acidity. So beans and legumes, peas, beans, and lentils, they are still considered kind of almost neutral. You know, they can be a little bit on the alkaline side. There are certain choices, and you can go kind of nuts with these lists, because like peanuts are a legume, and they're considered, and soybeans, more acid producing than some of the other choices. But I want us to kind of step back from all this detail and realize more plant, less animal, you know, less processed food, and we're going to be fine, okay? But I like you to have the details so you can see what's going on. So nuts are not that alkaline, you can see, because it only, if you think about eating a lot of meat and then trying to neutralize it with nuts, you're not going to get very far, okay? But on the other hand, plant stalks. So what is a plant stalk? Yeah, I knew it. That's the one that came to my mind too, okay? Very, very good at neutralizing acid, okay? Leafy greens, you'll hear me talk about these a lot. Very helpful because they're very rich in magnesium and potassium, and these help to neutralize acid. And then roots are pretty good, mushrooms are there. Fresh fruit isn't quite as neutralizing because it has these weak acids in it, okay? But in general, fruits, vegetables, whole grains, and beans are what are going to help to keep the acid under control. With beverages, water tends to be neutral, and one of the ways that we get excess acid out of our body is through urination. So again, you know, you hear health folks, you know, lifestyle people say, you know, drink your water every day, at least 6 cups or more, because the more you urinate, the more that helps the body to get rid of excess acid. So water, usually tap water, is around neutral. When they add carbonation, especially the cola type drinks, those can actually turn a beverage acidic. So if you think about not drinking water but drinking canned sodas all day as your fluid of choice, this would not be a good idea in terms of this tendency toward acidity. Water filters tend to remove the calcium, and so if anything, the calcium is what makes the water alkaline. You take a filter, remove that, and you've taken away the alkaline tendency and either brought it to neutral or maybe made it slightly acidic. Coffee, tea, and chocolate drinks tend to be more acidifying. Herbal teas, especially ones where you steep green leaves in hot water, you know, like fresh mint, think about that. You're actually helping to release some of the alkaline minerals into the water. So, you know, some of the potassium from the leaf, a little bit of the magnesium from the leaf is going to go into the water, and that's actually going to make it more health promoting even than plain water might be. And then fruit juices, lemonade, and wine tend to be slightly acidifying. The fruit, because of the buffers that are found in the flesh and the kind of inner peel of fruits, tend not to be as acidic as fruit juices. So are you kind of seeing this pattern that as you move toward processing and taking things out of their whole form, you end up with trouble? The other thing, in case I forget to tell you, that I want you to think about is grains. You know how we're always saying eat whole grains rather than refined. One of the hallmarks of whole grains is that it's much higher in magnesium and potassium. When you refine a grain, you're dramatically reducing the magnesium, which is an alkaline mineral. So when you're all the time eating, you know, products made from white flour rather than whole grain flour, again, you're tipping that balance more toward acid than neutral or base. So how are we doing so far? Okay? Okay. All right. Now, how many of you have heard about alkaline water? Okay. How many of you have one of these devices in your home? Okay. And do you like the effect? I mean, do you notice the difference?
I like the taste, but I don't know if we just bought it like
You're not sure.
I'm not sure, but again, I'm drinking more water, so that means that
That's
so
the
it's
bottom
kinda hard-
line.
it's kinda hard to-
I've talked to people that just swear by the alkaline water that they drink, and honestly, I think if it makes you feel better, that's fabulous. But we don't have to get expensive systems to get our acid-base in balance. I think what we need to realize is people that are buying these alkaline water, they're also told to drink, like a couple or 3 liters a day. So that's 8 to 12 cups. And probably if we drank 8 to 12 cups of any neutral even water and urinated more, we could help to get rid of some of this excess acid. So keep that in mind. The other thing to realize is that a lot of them are sold in pyramid systems, and so they can be quite costly, and the amount of cost may not actually be worth the benefit. There's also alkaline drops that are designed to be put into filtered water to put the minerals that are filtered out back in, and those can be safe, but they also can be corrosive if they would ever come in contact with your skin. And if you kind of go back to some of those kitchen cleaners that are really alkaline, they have those same capacities. So be a little wary of what's in those bottles. I just brought this along. I don't know if you can see what that says, but the nutrition labeling says proprietary formula, 2 milliliters. It doesn't tell you what's in that. And, I don't know if it's completely safe. It's very confusing because then it lists all those other things on the label, which are, they're like herbal kind of components. But you'll notice they don't tell you the amount of any of those that are in it. So, who knows what's in that? So I'm a little uncomfortable putting something in my water that I honestly don't know what the element is. I mean, if it said it was some kind of magnesium salt and it actually listed that on the label, I'd probably feel a little better about it. So I would just caution you about those alkaline drops if you're going to try one of those, to really try to see what it is, and be wary of labels like this that say proprietary formulas and they don't tell you what's in it. Okay, so you're all familiar with milk of magnesia, which we use for irregularity. It's highly alkaline. It's also mostly magnesium, so it would really help in balancing out acidity in the body. Seawater is also alkaline in comparison to the neutral tap water that we might have. And when you're tempted to use alkaline waters, you probably want to think, is it as alkaline as seawater? Because if it is, we're not supposed to be drinking seawater, So just be a little cautious about these waters that are out there. I also was sent something by a family member around the time we were worried about swine flu that was encouraging people to start adding baking soda to water and drinking a little of that every day to make their body more balanced and therefore more resistant to viral infections. And that kind of worried me because soda can alkalize and has been used like as an antacid for years. But people can also have a toxic effect from taking too much of it. And the issue is, how do you ever know, when you get to that point? It has very high sodium content. So every teaspoon of baking soda has about, you'll say 1,250 milligrams of sodium, which is our daily recommended amount is like 2,400. So you're getting half of the sodium for the entire day, just from that little teaspoon that you might put into water. So I'm not too comfortable with that advice that you hear out there. I also talked to a friend of mine who used to teach in the pharmacy school here. I think he actually still does. He's partially retired. And he was very concerned about people using these alkalizers because they can affect how drugs are metabolized. So it's something you really want to think twice about. And if you are using, you know, certain prescribed drugs or routine over-the-counter drugs, you might want to discuss the pros and cons with your medical care provider just to make sure you don't harm yourself. Okay. So the alkaline elements that I mentioned earlier, calcium, magnesium, and potassium, are the ones that help to balance out this tendency we have in the modern diet for acid production. Sodium is also alkaline. The problem is that table salt is sodium chloride, and chloride is acid. So we don't kind of think of salt. Sodium chloride is something that we would encourage to help balance, okay? But calcium you hear lots about, and you know that we need, if we're 50 or under, we need about 1,000 milligrams a day. And if we're over 50, we need about 1,200 milligrams a day. The reason I have the milk products up there is a typical serving of milk product. You could think of a cup of milk or a cup of yogurt, or about 1.5 ounces of cheese. So do you know sort of what 1.5 ounces looks like? An ounce is a 1-inch cube. So 1.5 ounces would be a 1.5-inch cube. And if you're thinking like pre-sliced American cheese, it would be like 1.5 slices, more or less. The challenge, I think, with milk products is the fat that they have in them. So, you know, the lower fat ones are a better choice. So if you're doing dairy foods, you can kind of mentally calculate how you're doing with your calcium. And you might be getting, say, 1 serving a day or possibly 2. If you got 2 servings a day, right off, you can kind of mentally say, I'm getting about 600 of the amount that I need, and then try to think about other sources that would help you add calcium. Other sources include things like broccoli, dark green leafy vegetables of the cabbage family. And the reason I say that is because other dark greens like chard and beet greens and spinach, which are typical greens that we think of, are really good for you for magnesium, but the calcium is complexed with oxalic acid, and so you don't absorb it well. So do you know what I mean by oxalic acid? It's like when you eat spinach and your teeth kind of get that chalky feel to them. You know, it's because the oxalic acid is sort of grabbing onto the enamel. So the greens that I listed there are considered good sources of calcium, but some of these others aren't so good for calcium. They're just good for other nutrients. Fish with edible bones is a good source. So last lecture I talked about sardines, and sardines, because of the soft and edible bones, are a good source, and canned salmon also falls into that category. Calcium fortified beverages, tofu made with calcium salts, and corn tortillas. Okay, if they're like the old-fashioned kind that were actually treated with lime, which is calcium carbonate. But a lot of the tortillas that we have out there today may not necessarily have been processed in the traditional way. So you really need to read your food label and see how much calcium is there. So I think calcium is not as hard to get as some of the other nutrients that we'll talk about. Vitamin D is really important for us to absorb and utilize calcium and magnesium. And I talked about this last time, but I do encourage everybody to have their vitamin D levels checked and make sure that yours are at the optimum level, so that you might be doing a great job eating these calcium foods, but maybe you're not absorbing them properly because your vitamin D level isn't where it should be. The vitamin D levels that are currently recommended should be between 40 and 60 nanograms per ml. And this website that I gave you, how many of you already know about Grassroots Health? I know Ronnie does. It has a lot of educational material on it about vitamin D, so it's a good one to check into. If your blood levels aren't adequate, then you can use vitamin D supplements. You could probably go 1,000 to 2,000 units per day and be perfectly safe. If you're under a doctor's care, they'll put it up even higher till your blood levels get where they should be. With magnesium, which is another alkalizing mineral, the adequate intake for males is 420 milligrams per day, and for females it's 320. And you can see, this is from national, the N. Haynes study that looks at nutritional intake of Americans, but look how woefully low we are in our magnesium intake as a people, okay? Lots and lots of people are not getting enough magnesium. So where do we get magnesium, which is important and critical for muscle contraction and nerve transmission, in addition to helping, neutralize excess acid? From avocados and broccoli, dark green leafy vegetables, beans, nuts and seeds, and whole grains. So, plant foods, okay? Especially dark greens. I mean, if you can learn to love dark greens, you're going to do much better in terms of alkaline nutrients. Potassium is also alkalizing, and an adequate intake is 4,700 milligrams per day. The average American is woefully low, okay, somewhere between getting 35, a third to a half of what we need per day by, published tables. The best sources of potassium are vegetables and fruits. People can use things like light salt, which is a potassium salt, or no salt. The problem is that because, again, it's potassium chloride, and the chloride is acid forming, so the net effect is not necessarily net alkaline. So if you really want to bring up your alkaline nutrients to get yourself back in balance, more fruits and vegetables are definitely what you would want to choose. Do you remember hearing about the DASH diet? That they had such good luck in controlling high blood pressure. Plant-based, whole grains. It wasn't vegetarian. There was, animal protein there, but it was a smaller portion of what they took in daily, and it was very rich in fruits and vegetables. And it did a remarkable job at controlling high blood pressure. Okay, so good evidence. Supplements sometimes can be beneficial. Enzyme supplements for people that are low in some of the digestive enzymes may help the body to handle food in a more efficient way and properly digest it. Some practitioners recommend what are called prebiotics and probiotics to create a more balanced intestinal environment. But honestly, I don't think we need to use supplements of those, because prebiotics are generally fiber. So like if you're eating plant foods, you're getting a lot of those prebiotics that the little bacteria like to eat, and so that the healthy bacteria grow. And probiotics are found in cultured dairy products. So you don't need to use supplements as long as you get both of those things in. And then antioxidants, or a good multiple supplement that has antioxidants, is always useful. Lots of evidence that high dose antioxidants is not beneficial, but kind of lower dose is a good idea. And remember, when you're eating colorful produce with strong flavor and strong color, you're getting a lot of antioxidants just naturally in the food supply. So the guidelines for maintaining a normal acid-alkaline environment in your body is to eat more alkalizing foods than acidifying foods at every meal. So why do we say that at every meal? Because, and I was thinking about this the other day, I was wanting to get something quick. I didn't have time for breakfast, so I stopped by Pete's and got a latte and a honey bran muffin. They're very good there. And then I thought, gee, that's net acid. You know, like the milk gave me some of the alkaline minerals, right? But the coffee was acidifying, and the bran muffin, even though it was a whole grain and a kind of healthier choice than some, you know, bun with lots of sugar on it, still was sort of tipped on the side of more acid producing. So that really wasn't a good choice for my breakfast that day. And I could have, you know, had a whole grain breakfast cereal with a little bit of banana, you know, or some berries on it. Or this morning I did, I put old-fashioned oats in yogurt overnight to soften it with raisins and some almonds. And that is a really satisfying breakfast to have, and it's a little bit better balanced. So you kind of want to think of each meal sort of not tip too far in the acid side. And usually the way that you tip it back to more balance is by adding fruits and vegetables. Okay, so a little bit of protein, go easy on the grains, have, you know, vegetables for lunch and fruit for dessert, that sort of thing. Increase the proportion of alkalizing foods if you feel that your body is in a more acid condition. And sometimes you can tell that, or you can try to tip it if you just feel off, you know. Sometimes you even notice that your mouth will feel more acid when you've had sort of a few bad days of eating junky food. Then go, you know, kind of get out your dark green leafy vegetables, do more big salads, do some soups, that sort of thing that would have more of these alkaline minerals in them. And over time, you'll probably help yourself balance out. Diets that are restricted to all alkaline vegetables or plant foods only are not necessary and not even necessarily recommended for more than a week or two at a time. My uncle was a health food fanatic, and he used to periodically go on what we would call green cream. He was going to a naturopathic doctor, and when he'd been eating too much bad food for a while, he would go on a few days of making these kind of soups that he would put, you know, zucchini and green vegetables in, and he would eat this, what we called green cream, because he would puree it, you know, several times a day. So that was sort of more of a purifying regimen that he would periodically go on, but you don't want to do that for a long time. In terms, well, we talked about avoiding meals that are solely of acid foods. And the other thing is to remember, if you have a day that, or a meal that's more acid, and you haven't neutralized that meal with alkaline minerals from the diet, then your body's going to pull alkaline minerals from reserve. So this is where the osteoporosis comes in. And this is a big problem when we are kind of running this chronic acid condition, is our body all the time is having to, instead of, you know, put the calcium and magnesium in, it's taking it out of the bank, so to speak, and that's not a good thing overall. The other thing, going back to some of the health effects of these chronic acid conditions, when you think about how we get rid of extra acid, if you're chronically overdoing acid, it sort of stresses things like your kidneys, which are all the time having to process all this acid. So, you know, a lifetime of this, and you've sort of compromised the whole renal system. And the other thing that they talk about is the loss of some of these acids via the skin that can be actually kind of irritating to the skin. So some people that are having what they think is a lot of problems with excess acid are encouraged to do these warm baths where they actually put like Epsom salt, which is magnesium, and some baking soda in, and make it pretty hot, so they're actually kind of opening the pores and helping to get out some of these acid components. So I guess the bottom line is we want to eat more plant foods, especially under-processed, whole, and colorful. the guidance is 4 to 5 half-cup servings a day of vegetables and 2 to 3 half-cup servings of fruit, and 2 to 3 whole grain servings. So a serving would be a slice of bread or a half cup of cooked grain or a half cup of cooked beans. So if you kind of hit those basic bases every day and then you sort of add milk products and meats and things around those, you'll be doing very well. Going back to some of the things we talked about at the beginning, other ways of reducing acidity would be to increase urination by drinking more fluids. And some of the diuretic beverages that can help would be whey or cranberry, actually, which helps one to urinate more. It's funny because cranberry also has a net acid effect in the urine, and women use it to protect themselves from urinary tract infections. But it also has a diuretic effect. Increasing sweating more, okay, which is where vigorous exercise comes in. And I've been forcing myself lately to go to the gym and get on the treadmill and the recumbent bike until my little body sweats, which I hate to sweat. So I just want to tell you that thinking about this has given me the motivation to do this more. Hot baths, as I mentioned, is another way of helping rid the body of excess acidity. Increasing respiration, which is where aerobic exercise comes in. And also, for those of you that do yoga or know about yogic breathing techniques, you know this deep breathing is another way of getting rid of those volatile acids. And then increasing elimination, which would be more fibrous foods, and especially, again, the fluids, which help one to eliminate. Especially warm fluids in the morning really helps to get peristalsis, you know, to get things moving through. So that's a lot of practical things that you can try, and I guess the bottom line I always come back to is eat food and not food products, mostly plants, and not too much, because, you know, if we eat great amounts, we create a lot of acid too. Drink plenty of water. Eat slower so that you actually don't eat as much and that you also get the food into smaller particles so you can digest and absorb it. I like to encourage people to practice gratitude, which also helps people to calm down, you know, before a meal so that you can not only appreciate the meal and be present with it, but that helps the whole digestive system to kind of settle down too. And then exercise for all the reasons that we talked about. So I'll stop at that point. I know we have maybe a couple more minutes for questions, and I also wanted to encourage you to go to our website to learn about our other services, because we do dietary analyses that we can send you reports on, and we provide a coaching service in addition to our cookbook and our classes. Thank you very much for your attention. So do you have questions? Oh, okay.
Talking about water.
Talking about water, you didn't cover the.
Is it on?
Actually was. Is it on?
Okay. Okay.
We're encouraged to drink more water. So that was one of the reasons we got this filter, this alkaline filter, because I don't like tap water. The taste of it, it's very hard.
It's also chlorinated, and that's acid.
I just could not take it. Now, what about osmosis water filter?
Reverse
very
osmosis.
Expensive, so that's why we didn't go there. But
reverse osmosis is also a good system, and that basically creates a neutral product.
It's neutral.
Yeah.
Oh, okay.
And it takes. I mean, there's no minerals in it, so that's the kind of sad thing.
Yeah.
Because spring water or even tap water has alkaline minerals. It's just that it also has chlorine, so sometimes it can be a little bit on the acidic side. But reverse osmosis is fine. Just remember that you won't be getting any minerals from it, and so you really need to make sure that your diet is rich in unrefined food to get the minerals that you need.
Okay. Another question, can I ask? I read somewhere that it was not good for your system to eat fruit along with your normal food. Is that true? Is that?
No.
It should,
There's so many rules out there, it's just mind-boggling. You can eat fruits and vegetables at the same meal. There are some people probably that are more challenged in terms of their digestive capacity. And so sometimes we try various things to see if their digestion is benefited. But as a general rule, that is not something that you have to worry about.
Thank you.
Okay. Are there any other questions? Yeah.
I'm sorry, what are tomatoes considered?
Tomatoes are considered a plant. They're a plant fruit. They're a vegetable fruit is what they call them. And they tend to be what's called weakly acid producing. So there seems to be some people that aren't able to properly metabolize these weak acids, or it tends to cause an increase in acidity. For most people, it's probably fine for them, you know. It's just sort of the unusual person. And the other thing to remember if you're going to do these weakly acid plants is if you're getting enough alkaline minerals from other sources and your body has a nice store of those, it isn't an issue. So it's kind of this net balance that you're working on all the time. Okay? Was there another question?
Yes, I wanted to know what your thoughts are about taking, for example, Nexium or Tagamet or Prilosec that actually reduces acid. And is there a way naturally through nutrition to offset that if that's something that has to be taken as a permanent kind of thing?
That's a good question. So she's asking about whether antacids have to be taken on a chronic basis. Some people have actually, the little sphincter between their esophagus and their stomach is kind of floppy. And so the stomach juices can come up and do some damage. And that's actually, yeah, and if you have that, you do really need to watch out, because if you get damage in that area, it puts you at higher risk for esophageal cancer. Okay. So in terms of the antacids, there are many ways of reducing the need for so much of them by having smaller amounts of food at a time and not lying down, you know, within a few hours of eating. So those are all things to try, and if it hasn't worked for you, then you take the antacids, because the side effect of not.
Get off the antacid or the prohibitor, I'd like to know if there's
is there a side?
that can increase that naturally, the acids that help.
Well, the thing is, you're having to take the antacid to protect you from a really serious health consequence. And the antacids have their own side effects. Like, you have to keep an eye on calcium absorption, you have to check your B12 levels, all of those things. So that's an issue. You were asking if...
Should I take more probiotics? Should I take more prebiotics? Is there certain things that would help increase the flora and fauna in my tummy that the prohibitors are taking away?
Yeah, that's a really good
So you
question.
don't have to answer that now. It's just
Yeah, because...
some other people might be taking Prilosec or Tagamet, and those all do the same thing.
Yeah, and I just want to make the point that you're taking them for very good medical reasons, and so you need to keep taking these antacids. There are a lot of people that are just using over-the-counter antacids because they're eating too much rich food in too great a quantity, and that to me is kind of a sad thing for their overall health, because they're doing these things that are affecting their enzymes that if they changed the way they ate, they wouldn't need to use as much of these over-the-counter drugs. So the issue is medical reason to do it versus just kind of eating a, you know, way too rich diet or too much, okay? Did you have a question back there? Yes, yes, uh-huh.
You mentioned blood normally the pH should be neutral. Is it worthwhile having it tested? Is this something the
I'll tell you, no, well,
do, you know, as part of a blood panel?
They do. If you're ill, they'll check that, but I'll tell you that if your blood doesn't stay in a pretty tight range, you're seriously ill. So there's so much buffering that goes on to keep you basically alive and functioning. So what what we're talking about is trying to make sure that the body buffering systems aren't, you know, pushed to their max to try to keep your blood where it should be. Okay? So I don't, to answer your question, I think it would be unusual, unless you were seriously, seriously ill, to have your blood pH, you know, that far off of the normal. Okay? It's just all these other things that are happening around the edge of that that are causing illness, if that makes sense. Trying to keep your blood where it should be. Okay, was there anything else? Okay.
You mentioned something about lemons and how they seem acidic, but they work in an alkaline
Well,
way.
they're acidic
expand?
when they're, you know, lemon juice is acidic. We know that from putting litmus paper in it. But actually, citrus, actually, because of the potassium that it contains, can actually end up alkalizing the system and creating more of an alkaline urine if you did lots and lots of it. So that's why it goes in acid, but it comes out.
So is that a good thing for you?
Actually, a little bit of lemon juice in water is a way of getting more water down. Yeah. And, you know, having said that, I don't think I would do that in a plastic.
Yeah.
Please don't. Please. This is my green tea in my inert glass. Because, you know, try to reuse glass. Plastic, especially when you're putting acidic components in it, is like, it's not good to put into plastic. Okay, anything else? One more? Okay.
Does cooking vegetables increase the acidity?
If you overcooked it and lost some of the alkaline minerals in the water and then threw that cooking water away, maybe it would change it slightly. But overall, there's so much of that. Like if you're thinking of a green leaf, I wouldn't worry too much. In general, we recommend that you don't overcook vegetables. You know, undercooking them is always a good idea. Yeah. Mm-hmm. Anything else? Okay. Thank you all for coming.
This has been a UC San Diego Blinkcast. For more, visit us online at blinkcast.ucsd.edu.